Okay, so I'm David. I'm a white Irish man. I'm somewhere in my 40s. I'm not going to specify, so you can guess. I used to have red hair. Now I have less hair. Yeah, but anyway, I'm an associate professor in a university in Dublin called University College Dublin. And most of the work I do over the years has tended to be in the area of digital mental health. So in the past few years, a lot of our work is focused on the idea of help seeking and how can you support people that are sort of seeking help or just becoming aware of the difficulties and trying to sort of identify and offer support as quickly and as early as possible. The other work I've been doing over the past few years has been coordinating an EU PhD training network in the area of digital mental health. So that's been really, really interesting. And then over the years, I've been involved in a variety of projects around games and mobile apps, sort of blended online CBT, and then games and apps and young people. So I'm going to just sort of dip in and out of various projects as I go along here. But the first thing I wanted to do was just mention sort of one of the places I started. When I was a PhD student, I was a designer, I was a computer scientist, and I knew very, very little about mental health. And I remember one of the things I was asking my supervisor in psychology was, well, look, what makes a difference? What should we be really, really thinking about here? And this was a paper that he recommended that I read, and it really struck me at the time, and it sort of stayed with me. And it's a paper by a group of authors called Assay and Lambert. And what they were trying to do was say, across all mental health interventions, what are the things that really make a difference in terms of positive outcomes? And they did an analysis of lots and lots of prior papers. And what they found, I always thought was really interesting. They said that more than anything else, the thing that matters is client factors. So the person's strengths, the resources, the environmental context in which they find themselves, and to what extent we can draw on that. The second one was just the quality of therapeutic relationships. So assuming you've got a relationship between a person and a therapist, is that a strong relationship? And to what extent can we draw on that? And then the other thing that really struck me with this paper was that when you go down the list, things like therapeutic models and sort of specific techniques like CBT or psychoanalysis, they're important, but they seem to be, well, at least according to this paper, they're less important than these other broad factors like client factors and relationships. And as a designer, I thought that was really, really interesting, because as a designer, I don't think I'm going to innovate in terms of theoretical models of mental health, but I do think I know how to think about personal factors, and I know how to think about relationships. So that was really, really interesting for me. And the 3 points I have today, they kind of, to some extent, I think, almost go back to that particular paper. So I've just picked 3 things that I felt have been important to me across various different projects. So the first one is just to focus on personal factors. And the second one is to design for relationships. And then the third one is just to think about and design for different types and different means of connectedness. So I'm just going to pick apart different examples of each of these and sort of illustrate them with some examples of projects we've done. So the first one is personal factors. And this is leaning on the idea that client factors really matter when it comes to designing an effective mental health intervention. I'll just give you a few examples. So one of the first things I think you can think about when you're designing with people in mind is to ask yourself the question, well, where are people? When people want help, when people are seeking, they're experiencing difficulties and they're looking for some form of support. So we did a survey about this, and we sort of asked people where, if you were experiencing a mental health difficulty, where would you first go to look for help? And it turns out that most people go to the internet, or most people these days, particularly young people, they go to some form of technology. And we found that 83% of people say they go to an internet search. So for most people, when they're thinking about, I need help, the first thing they see is a Google search bar. And that's just where people are. Other places people go are health websites like the NHS. They'll go to social media. They'll go to specific apps. And then a small number of people will go to places like bloggers and influencers. But I just think that's really important. Where are people when they need help? And it turns out the first place they usually are is a Google search. So a second thing that came up from this particular research is, well, people need help, but like, what is it that they need? And it turns out that people, they need many, many different things. And sometimes they need information. And I think a lot of the services out there, they lean a little bit too heavily on this idea that we provide information and that is help. But it actually turns out that people, when they express sort of a need, they express it in many different ways. So I need information is one thing they might say, but they might say, I need something to do right now. Don't tell me about something I can do next week or something I can do in the long term. Just give me something I can do right now. For other people, it might be a need for control and autonomy and the desire to not hand over control of a process to somebody else. For someone else, it might be autonomy. Or then for someone else, it might be, I really need to connect with someone. I want to connect with a person. I don't want to be speaking to a computer. So that's another example of personal factors. And then the last one I'm just going to say is, when people do arrive somewhere, when you've identified something that might be helpful to them, one of the things, and this is a lesson that goes back quite a long time, is the idea that you should put the person in the foreground. And this is an example. The reason here, this is my Facebook page. This is my Facebook page from 2009. And this goes back to the early days of when we were thinking about something that became the Silver Cloud platform. I'm not going to say much about this because there's lots of people on this call that have been involved in Silver Cloud for a lot longer than me. But one of the things we really thought about when we were designing the first prototypes for Silver Cloud was the idea that a lot of online CBT systems at the time, when you logged into the system, you saw a program. You saw a CBT program, whereas when you logged into something like Facebook, you saw a representation of yourself. You saw a representation of your own interests. You saw a representation of your friends, your relationships. And that was actually one of the interesting things that sort of was represented in some of the early prototypes for what at the time we called iSteps, but later became Silver Cloud. So that's just examples of personal factors. The second one I want to talk about is relationships. And again, this is something that really struck me from sort of early on in my work in this area. I was working in a computer science department, but I was also spending a lot of time in a child and adolescent psychology department. And one of the things that the therapists I spoke to really valued was the idea of relationships. And they saw the relationship that they had with the young people as being one of the real drivers of positive change, of positive outcomes. And it actually, that meant that they were concerned because I was proposing introducing technology, and they saw technology as something that was potentially going to be detrimental to relationships. So a big part of our early thinking was the idea of, well, no, technology doesn't have to be detrimental to relationships. It can actually potentially enhance relationships. It can change the dynamics of a face-to-face conversation in a way that's potentially really beneficial to young people in particular. So it's this idea that you still maintain a face-to-face or a direct relationship with a therapist, but you supplement it and sort of change the dynamics of the relationship. So that led to a project which has been going on for a while now. It's called Pesky Gnats. This is a computer game. It's used in face-to-face clinical interventions where a young person and a therapist sit down together, but instead of having a face-to-face conversation, they play a computer game together. And the overall product consists of the computer game they play together, a mobile app that the young people can use between sessions, and then an online training program for therapists. And I could go into a lot more detail on this, but like you've still got this basic idea that you've got the two people and there's a relationship between them, but then you've got various different relationships going on with technology. And I just thinking about all those different relationships and the dynamics of them has been something that I've always felt really makes a difference. These are just two quotes that I took from sort of early studies we did of the Pesky Gnats game. And it just sort of shows the idea that the game is changing the dynamics of a relationship. And this is just things that therapists say. So I thought it was really good from an eye contact point of view. This young person doesn't like making a lot of eye contact. So having a screen there was useful. It reshaped the dynamics of a conversation. And then a second one, so it was almost like a translational object, or kind of like an external mediating factor. So the sessions were less directive. The child found it easier to engage through the medium of a game. So this is just a simple example of you put a piece of technology into a two-way conversation. It changes the dynamics, but it does it in a way that's still hopefully beneficial to the therapeutic relationship. So the last one I'm going to just touch on here is connectedness. And this, it's similar to relatedness. When I think about relatedness, I tend to think about relationships between people and therapists, whereas connectedness I think of as being much broader. I think of it, you can connect to therapists, but you can also connect to lots and lots of other people. And one of the things that we really found in our work around help seeking is this idea that people have different preferences in terms of connectedness, and you can support connectedness in many, many ways. It doesn't have to be a face-to-face conversation. For some people, connectedness means reading other people's personal stories. It means reading messages on social media posts. For other people, connectedness might mean asynchronous, anonymous asynchronous communication. Whereas for other people, connectedness means I want to have a direct conversation with another person. But we can support all of these sort of means of connectedness. And I think offering different options here can make a real difference. So one of the things we've been talking about in the context of help seeking is the idea that connectedness you can offer a series of small steps. So you can start with something that's self-help oriented. You can move on to maybe something that's anonymous and asynchronous, but you offer a pathway towards something that's sort of a direct human connection. And you don't assume that people will follow all of these steps, but you make them available. And depending on a person's sort of current place or their willingness to engage with another person, you can decide what's most appropriate. Yeah, so that's it. I mean, that was a very high level overview. I'm happy to go into any of those examples, but it's three things: focus on personal factors, think about relationships, and support different levels of connectedness.
Thank you. I think, well, probably all three of you have kind of covered that sort of need for, individualized support and access to services in different ways, depending on what people need or what their preferences are. And there's been some chat about the kind of levels of connectedness and that sort of model. And I think, yeah, it's really interesting. Does anybody have any questions? Quite a broad question. There we go. How do you decide on those three core areas or insights? I guess it's hard to sum up 20 odd years of work in a few slides. But...
Yeah, I mean, I had other ideas in mind around sort of information, like the ways of structuring information. That the other one I was leaning towards was just the importance of integration, like integrating multiple services rather than offering single services. But I think these were just ones that sort of stood out to me as being things that, like, right at the beginning of my own work in this area, just struck me as being important and have sort of stayed with me across a series of projects. I mean, in any of these areas, the detail really matters. Like I'm saying, consider personal factors. Like that's huge. I mean, you can go into a huge amount of details on it, but it's just a starting point. And yeah, I mean, I could have said design for engagement. I could have said think about acceptance, but these just struck me as being things that they've been relevant in lots of projects.
We've got a few more questions now. There's one from Sarah about AI. Have you got any thoughts on or know of any ongoing research in relation to how people will search for mental health support in the future in relation to AI or language models replacing Google search?
Yeah, we've sort of experimented a little bit, just like not in a formal manner with sort of ChatGPT and things like this. And I mean, they're not the solution. I mean, like Google is not the solution either. But like people have sometimes said that I seem very critical of Google. Like I'm not. Like Google wasn't designed to provide mental health support. Google was designed to organize the world's information. But the reality is that that's where people are going. My thinking about help seeking is that it needs to become more guided, and it needs to become more I use the word conversation. I don't mean a conversation with a person. I mean, like in Google, you type in a query, and then you get a list of pages, and then you're left to sort of fend for yourself. It doesn't need to be that sort of single shot query. It can be more of a guided process. And the question then becomes, how do you guide that process? Like you could do it with AI, but there's lots of different ways you can guide that process. And I think understanding a little bit about the person makes a big difference there.